Welcome to The Last Word, my weekly commentary on life and work in San Antonio and Texas. Bexar County Commissioner's request for $60 million in the next state budget to support expansion of the county's mental health hospital campus for desperately needed inpatient care seems like a relatively small sum in the scheme of things. Texas legislators will have tens of billions of dollars in surplus funds to allocate during the current session. And that doesn't count the state's rainy day fund, which will surpass the $20 billion mark and give the state's Republican-controlled Senate and House another source of revenue to address the state's mental health crisis, growing homelessness, and the inability of cities and counties to adequately respond with inpatient and outpatient services. Many of the state's most unstable individuals are consigned to outdoor encampments, or they're housed in county jails, which lack the funding and the specialists to treat people. Locally, San Antonio is seen as a national leader thanks to the Haven for Hope, which offers comprehensive treatment and housing programs and access to dozens of participating nonprofits that offer their pro bono services to the homeless community. Yet city and county budgets are inadequate to meet the growing needs. State legislators have the power to make a significant difference this session. Of course, Republican state leaders could unlock tens of billions of dollars in federal Medicaid funds to remedy the fact that Texas has more uninsured adults and children than any other state. The state did agree to address badly funded and deteriorating mental hospitals in our major cities several legislative sessions ago. As a result, in April 2024, the Texas Health and Human Services Commission opened the new 300-bed state hospital here that replaced the county's aging psychiatric facility. Bexar County's new $357 million hospital features single-person patient rooms, furnished common rooms, and outdoor spaces designed to promote healing and recovery. Now, county officials want to use the old vacant buildings on the state hospital campus to expand inpatient care. It's a very worthy endeavor, and if county officials win state funding, local officials and nonprofits will be able to further reduce the number of people living on the streets and reduce the number of people in the Bexar County Jail whose offenses stem from their untreated mental illness. Who would run the expanded facility remains unaddressed. That could be worked out once the necessary funding is in place. Until then, people with severe untreated psychiatric issues will often find themselves on the streets or in detention. We can do better. If only Texas legislators and the state's top elected officials will acknowledge the problem, one that's growing worse with each passing year, and commit the resources needed to address our community's mental health crisis. That's my last word for this week. Thank you for listening and sharing this with colleagues and friends. And please sign up for our new newsletter, Monday Musings. Big City, Small Town is brought to you by Western Urban, building the city our children want to call home, and Geekdom, where startups are born and smart ideas become businesses. Our producer is Corey Ames, video by Erica Rempel, sound engineering by Alfie De La Garza of Sound Crane Audio. We will see you next week.